Well, great. Well, and speaking of the next generation of products, what is that other product over there?
Alrighty, all right. Now we get to drop stuff.
Okay,
So,
what's this? That's
this
fun.
Is our
It looks like
mobile
a
clinical assistant.
it looks like a clipboard. People see it.
It was
It reminds me of one
in
anyway.
conjunction with Intel's Digital Health Group. It's an all-in-one purpose-built device built specifically for healthcare. The C1 may have other applicable markets. We've targeted it for healthcare, but the H1 truly is a device built specifically for healthcare. It is a fully sealed, fully rugged device. What that means is if it gets dropped, bounced, jostled around.
You guys didn't get to see that. You want to try to? Okay, try again. There you go. Very good.
And this is, maybe 8-10 inches, but it is actually designed to meet mil-spec 810G. What that means in the real world.
Yeah, what does that mean?
If I were to sit it on a patient bedside and it were to fall onto the floor, I simply pick it up, wipe it down with alcohol, and put it right back into service. If I'm in the emergency room environment and I have to drop everything to help a patient, maybe with a cardiac situation, I can drop my device, kick it to the side. Then as soon as I'm ready to go back to doing what I was doing before, delivering care and documenting, I can just simply grab the device, wipe it down, go right back to
And
service.
what if I get blood on it? I mean, is alcohol the only thing that you can use, or is it anything? I don't know. What kind of cleaning products can you use on it?
We've actually built a little machine at our factory in Japan. We had to build a machine. We looked for engineers that would get excited about wiping devices 10,000 times, and we just couldn't find any. So we actually built a little machine that mimics the wiping action. So we've tested all the most commonly cleaned components or areas, such as your hand strap. And you'll notice we also have a very similar hand strap on the H1 as we do on the C1. The C1 hand strap is a direct result of the popularity of the H1 hand strap. So we also built, I don't know if you can see it, but we built a little screen cleaning utility. So as I'm trying to clean and sanitize my devices, I actually have the ability.
Oh, that's really good. Can you show that a little bit closer?
Absolutely.
See, so as he wipes it with his finger, it shows you where the cleaning has happened, so you don't miss a spot with the alcohol, right? So make sure that the whole thing gets cleaned.
That is correct. And what it will also do for your IT directors, it'll create a time and date stamp of each time that I've cleaned that. So if you've got an infection control group that wants to set particular policies and procedures for that, we can help you comply to those. Now, it's very evident I'm using my finger to do this, but the thought is we begin to create habits, and if I get accustomed to every 30 minutes or every 15 minutes, every time I swap a battery, whatever those intervals may be, if that becomes a habit, I'm just going to naturally grab my Sandy wipe or my alcohol-based cleaning solution and clean each time that I'm done with the device. We did not
Especially if you can track it. I mean, I can imagine you can have a little contest, the ER versus, internal medicine, or the geriatric ward versus, the ICU or whatever, who's the dirtiest team, and try to improve, compliance with disinfecting measures. And I think that might carry over to people washing their hands and doing other things just every time they think about. I mean, this is a fun little game, actually, that will remind people to wash their hands and clean their devices and that kind of stuff.
Exactly. And again, it's all about creating those good habits. If I'm forced to clean every 30, 15 minutes, every hour, every time I swap a battery, it's going to create those good habits. I was not able to show it on our C1, but we actually have these same features, and it was interesting because you asked, well, how do I clean the keys? We actually now, once you're done cleaning the display itself, we've got a little application that will map each individual key. So as I clean it, it'll highlight the key, and it will not allow me to exit the application until I've actually cleaned my keyboard as well. A lot of folks love this feature, but then, when it translated here, we only had a feature that would clean the display, and obviously I touched the keyboard more often on a much regular basis than I do actually the display itself. So we've actually created a nice little cleaning utility for the C as well.
Now, keyboard-wise, how does the keyboard work here? I mean, it must be a touchscreen, sort of like the iPhone.
It is. We've actually created and have worked very closely. And if you'll notice, I don't know if you can see it, but right here in the center of the screen, and I need to, and my apologies, but I should have turned the display brightness up a little bit.
Finished cleaning.
If you're finished cleaning, so I click finished, and now that is where that time and date stamp is created. You were inquiring about the keyboard itself. So you've got the Microsoft on-screen keyboard that will allow and pop up, and you can obviously scale and make that larger. Panasonic has written actually a customized keyboard that will take up about 45% of the display. Exactly.
Yeah.
Now, I'm not going to do complete patient visit history, things like that. Obviously, I'm not going to do 10, 15 paragraphs, but if I need to do just those vitals captures or enter that particular as I'm doing rounds, it's a very easy interface with which to enter that information.
And that's going to sync with my other computers?
It will. As soon as you dock, it'll generally a lot of folks in healthcare are running a client server environment. So as I enter information, it will automatically dump onto the back end of the server itself.
Wow. So who likes this the most?
Well, it's quite frankly nurses today. We find doctors gravitate more towards a keyboard. That's why we actually manufacture 11 different mobile products. As you can appreciate, there is not a one-size-fits-all. I'm very fond of saying, the perfect device would be a 19-inch convertible laptop that weighed 1.5 pounds, had 18 hours of battery life,
Right.
was $1,000 and would fold up and slide in your front pocket or your lab coat pocket. Unfortunately, physics won't allow for that today. So we'll continue manufacturing a multitude of devices because there are a multitude of workflows and requirements that our end users, our customers, which is your peer group, have.
What about mobile integration? Do you have any mobile strategy for having alerts perhaps being sent from this to a patient's cell phone or to one of your peers' cell phones, or taking some of the software that's used here and making it mobile in some way?
From our perspective, we manufacture the devices. There are a lot of very qualified folks that manufacture software solutions, and we just ensure that we use Intel standard products so that you can build a strong, stable platform from a software perspective. But we're really kind of agnostic there, because as you can appreciate, you could visit with, I live in Nashville, and I could visit 3 different hospitals in Nashville, and they could all have 3 different strategies, 3 different software solutions. So again, it's our job to build devices that are Intel standard compliancy so that they'll run across the board. But we also have about 125 software engineers. So if we get those curveballs, one of the challenges that we had with the MCA with our H1 is we've got a barcode built in. Well, McKesson, Eclipse, Epic, all the major ISVs all have different little.
So you can
software.
scan barcodes with this little thing
You
down
can.
here?
So I can do bedside meds administration, right patient, right dosage, to cut down on those types of errors. But one of the challenges that we found were each one of the ISVs, they use what are known as symbologies. Basically, when they scan a barcode, it'll add characters or strip characters. Well, none of them use a standardized system. So we have our software engineers available, so if we run into those types of situations, we don't always have to bring in those ISV vendors, those software partners. We can actually handle and support the majority of that in-house.
So wrapping up, what do you think is the most exciting thing that you're doing today with Panasonic?
I'm extremely excited about our C1. This is a product that our customers have requested and have been clamoring for again for almost 6 years. So we couldn't be any more excited to be announcing this product at HIMSS. And we're very excited about where this is going to take us as far as our position in healthcare, and as well as the solutions that we're going to be able to provide to our customers.
Fantastic. Well, it looks great. Dr. A, do you have any final closing thoughts? Any questions?
They love when you dropped it.
Okay.
So the Twitter gallery loved the drop demonstration for the Tough Book. So they really appreciated that. Thank you for that demo. We're simple folks, really. We just like it.
Well, we'd be happy to come out and let them do it themselves.
Okay.
Because it's real easy for me to demonstrate here, but we really like for our potential customers to put our devices into use, test those, pilot those, and provide us feedback not only on what they like, but how do we make our products better. We love for our customers to push us. It keeps us on our toes and ensures that we're always delivering the best solutions for our customers.
So for new potential customers out there, how do they get in touch?
You can visit our website. It's panasonic.com/toughbook. We've got a nice little healthcare section there. You click on that. If you'd like information, there's a little button there. You can do live chat, or we'll route you to one of our inside sales support folks. They simply reach out to us, and we'll get out to see them as quickly as we can.
Is there an email that you'd like to give to the audience? Perhaps yours?
Yeah, if you'd like to reach me, I'm actually National Sales Manager, so I manage the healthcare team as a whole. I can be reached at Jeff_Rogers, ROGERS, @us.panasonic.com.
Perfect. And do you have a booth here, of course? What's the number of the booth?
2366.
2366. So if you all are watching and you're actually at HIMSS in some corner, you can go to their booth and find them right there.
Thank you very much.
Okay. Well, thank you very much for being here. This was a terrific demonstration. I don't think we'll be dropping anything else today, so that was a standout for sure. It was a lot of fun.
You need some excitement, come visit our booth. We'll let you drop some stuff over there as
that's
well.
Right.
So.
Okay, that's great. Thanks so much for
Thank you
joining
very
us.
much. Appreciate
Take care.
your time.
Okay, guys, we'll be back in 10.